Today we're going to talk about the challenges and obstacles that families encounter. So some of the more common challenges for families include separation and divorce, moving or changing your living environment, financial crisis, illness or terminal illness of a family member or a family member passing away, physical disability, cognitive disability or challenge that could be anything from Down syndrome to a learning disability, emotional or psychological disability, a family member diagnosed with a major mental illness or some trauma. Let's say your family was in an earthquake, that can cause significant emotional trauma. Drug, alcohol, or gambling addiction, domestic violence, which we've already talked about at some length, and other stressors that we'll discuss later. We've talked earlier about the hierarchy of needs. I'd like you to keep that in mind as you're going through the challenges that families face. Here's a really good explanation and visual of the hierarchy of needs. Think about it as we go through things, and we'll talk about it again at the end. So separation and divorce, there's a big one. Almost 50% of all marriages in the US end in divorce. The average length of a marriage now is about 8 years, which is up from, it was 5 years a few years ago. 60% of all second marriages end in divorce, and 73% of third marriages end in divorce. If you don't want to get divorced, you marry a farmer, minister, or eye doctor. And if you're looking forward to it, you marry a dancer or a bartender who have the highest divorce rates. But here we're talking about families, so let's talk about families. One of the most important things to remember about divorce in a family is that children often blame themselves. Children are self-focused, and the younger the child, the more they think that they're the center of the world. Not in a negative way, but they have to believe that way at that age. So without expressing it with language, children often blame themselves when parents get divorced. And it's important for parents to remember to address that, even though the children aren't expressing it through words. Of course, there goes the changes in living situation. When your parents get divorced, you naturally have a separation of living space. Some parents get divorced and stay together and live in the same place. That is not unknown, but it's not the typical thing that happens when parents get divorced or separate. Usually what that means for the children is that they are living in two places. They may be living a different amount of time in each place. They may live in a rural area with their father and in the city with their mother. There's a lot of different possible configurations of living situation, but it's definitely a huge change. And as we'll talk about in a little bit, changes in living situations are also really difficult for children. So the change in your time spent with each parent, when parents are living together, the time you spend with each parent could be equal. It could not change very much, but usually it changes. Like your dad may have you for 2 days a week only on the weekend, or you may do 4 days with one parent, 3 days with the other. You may have your parents changing who's in the house for whatever days. So the time that people get to spend with you, usually if you have a weekend parent, a mom or a dad, that person spends a chunk of time with you and is not as responsible for the everyday workings of your life. Hostility between parents. Sometimes parents, and this is a horrible thing to do, they use the children against each other. We all know about that. Division among children. That usually happens if the children are older, when the parents get divorced. And what I mean by division is not just an emotional division, but an actual physical division. I want to live with mom. I want to live with dad, which creates, of course, difficulty in the communication between children. I was just talking about that communication breakdown. There is a lot of ways communication can break down in a separation or divorce. Very often between the parents, there's a breakdown of communication between the parents and the children. There's a lot of ways that can happen. It can cause relationship or commitment issues in the children when they get old enough to have relationships. And it can set up a misunderstanding of unconditional love for conditional love. Children may be trying harder to get the love of one or another parent, even though that on the parent's part, it probably has not changed. So let's talk about changes in living situations. There are a lot of things that can cause a change in our living situations. Perhaps we have to move because a parent has a new job, or there's some kind of military relocation. We could be getting a new home, because of a change in socioeconomic status, up or down. There could be a separation or divorce, which we've already talked about. You could move in some extended family, for instance, if your grandmother had to move in with you, or you could be entering into a blended family if one of your parents gets remarried. And that may include moving to a new house, and it may not. So one of the things that happens when our living situations change is right away there's a loss of sense of security and safety. And security and safety are one of those things we have to have. If you look at the hierarchy of needs, it's right above biological needs. We need to feel secure and safe in our environment. Now, for some people, it takes a short amount of time to feel safe and secure again. For some people, it takes a really, really long time, or unless it's addressed, it really shakes their foundation of safety and security. So everybody handles change differently, but nobody kind of transitions perfectly every time. If you find out how to do that, let me know, okay? So there's a change in the family or home structure, and I mean that both emotionally and physically. So, for instance, if you live in a ranch house where the 3 bedrooms in the house are on one end of the house and everybody's really near each other when they sleep, and you move to a 2-story house, or let's say a split level house, where maybe there's only 1 bedroom for the parents, master bedrooms on the bottom, and then the kids are upstairs, or there's 2 bedrooms downstairs and 2 bedrooms upstairs. When we watched Virginia Satir do her family therapy, she really showed us how proximity changes how people feel. So the physical proximity to your parents and your siblings, the structure that you live in and the structure of your family really makes a big difference. There's potentially a new school. And the reason I put new school in here separate is because for a child, school is such a big part of their lives, and a new school can be really frightening. Some kids get excited about it, but everybody has anxiety about a new school. I've never met a child that didn't have anxiety about a new school. And really, it's about the belongingness. It's, am I going to fit in? Is there a group in which I fit in? Children who have specific things like band or a certain sport they play make an easier transition into a new school if they can sort of get to that right away. But a new school is a new paradigm, and it's not always easy to navigate. And that puts us into talking about friends. And the reason I have new and virtual relationships is because in the days of Skype, which is what we're in now, and all other kinds of, Facebook messaging, video chat, it is sometimes more of a challenge for children to make new friends and to transition into their new environment, because they can still have such significant relationships with the friends they've left behind. Really, today, we don't really leave friends behind. We just see them on our electronics instead of in person. And yes, it's different, but it can also keep a child from making that transition. Why do I have to make new friends if I can see my friends on Facebook messaging, video chat every day? I'm probably saying that wrong, aren't I? Anyway, you can see where the challenge is. It's good because it helps with the child's sense of safety and security. I have these friends, it's going to be okay, I can still talk to them. But it also may isolate them in their new environment. Think about that a little bit. And then, of course, there are some cultural changes. If you move from one kind of neighborhood to another kind of neighborhood, maybe they have different things. You could have lived in a suburban neighborhood where they had, neighborhood barbecues on your cul-de-sac every week, and move into a city where nobody really talks to each other because it's not necessarily safe to do so. Hopefully, most changes in living situations are not that disparaging, but they may be that different. The bottom line about this is that it's a difficult transition for everyone. Some people bounce through it and some people are just dragging through it, which is hard when you're a child. So let's talk now about financial crises. I think actually, and I don't have the stats to support this, but I think more people get divorced over money than even sex, which is amazing. I mean, the most difficult things in a marriage that are the same things that are difficult for anyone to talk about, which is money, sex, politics, and religion. But let's talk about a financial crisis, because the first thing about a financial crisis is that it may cause a change in lifestyle. Depending on the level of crisis, you either have to, tighten our belts, as we say, or you may have to move or change. You may be unemployed for months and have to go to a food bank or ask other people for help. Depending on the level of crisis, that can really change how you live and how you feel about how you live. So we talked about systems a lot, and hopefully you remember when we talked about systems, what happens when one person in the system has an extreme stress reaction, or one part of the system becomes totally dysfunctional. What happens to the rest of the system, right? Because every individual affects the system as a whole. There's a possible polarization of the system, which is basically a fragmenting of the system. People sort of going to their corners. The parents may separate from the children may align themselves with a specific parent. And this is not in a versus situation. It's in a trying to feel safe or secure, and therefore making alliances in which you feel safe or secure. Changes in communication styles. What I mean by that in this context is that often parents will feel guilty or they're grieving. They obviously feel responsible. And then there's oftentimes a lot of secrecy around that. And some of that is appropriate. You don't want to stress your kids out about your financial situation, but you also want to be honest with them. And if they feel like there's a bunch of secrecy as far as communication goes, that also upsets their sense of safety. there's really a spectrum when you talk about illness, from anywhere from having the sniffles up to the death of a parent or a child. I want to tell you a story first about a young woman. We'll call her Sally. She was born with very little brain activity, and her parents had the choice of taking her off life support when she was born or continuing to support her on life support, knowing that she would never be able to speak to them or see them. And that's what they did. They kept her on life support for about 3 months until she started breathing on her own and her heart was beating on its own. She required, for the rest of her life, almost constant care. She was fed through a G tube, a gastric tube. That's a tube that goes into your stomach from outside, and you put liquid in it with a syringe. She had to be turned all the time. She lived to be 13 years old, and then she finally, I think she succumbed to pneumonia, if I'm not incorrect. But during her lifetime, her entire family, she was the center of this family's existence and identity. So when she passed, the family sort of lost their sense of identity. Now, many families deal with people who have long-lasting illnesses, terminal illnesses, die young or die not in their due time, as they would say. And the difference is the kind of care somebody needs, whether they're integral or sort of outside of the center of the family system. Caretakers, some people are natural caretakers. I'm sure you know somebody like that, or you are that. But the extremity of caretaking for someone, let's say, who's terminally or indefinitely ill, can really be overwhelming. And again, in the world of family systems, if one part of the system is overwhelmed, overstressed, then the rest of the system has to adjust to accommodate that. And over a long period of time, that can really be difficult for the system. And resentments can form about who's spending more time with the ill person, the time the ill person is taking away from the rest of the family, or just the resentment of the feeling of resentment that is not actually resentment. It's actually just a desperate kind of ongoing grief. Obviously, like I just said, the length of illness affects all kinds of factors. The type of illness has a profound effect on the family system. My mother had breast cancer twice. The second time she had breast cancer, both times we took care of her. We sort of took turns, or we gave her rides to chemo, or we took care of her after. The second time she had breast cancer, it was not as serious a case of breast cancer as the first time. The first time was stage 3. The second time was 16 years later, and it was stage 1. But after the treatment for the breast cancer, my mother developed a chemo-initiated dementia. Now, caring for someone who is going through chemotherapy treatment is very different from caring for someone who has dementia. It is the difference between having to be on call when things happen and having to be on call 24/7. So the type of illness is really affects how the system functions. When someone dies in a family, a family system experiences two levels of grief: individual grief and system grief. And individual and system grief don't never necessarily line up. The stages and timing of grief will differ depending on factors such as the relationship with the person experiencing the illness, the level of guilt, remorse, love, physicality. If you are dealing with someone with a serious illness and you're caring for them every day, and another family member lives an entire state away, there's going to be a difference in the way you grieve and in the length of time, the intensity, all of that stuff. Also, the relationship between, a mother who loses an infant child and the grandmother or the cousin or the uncle or aunt, there's a difference. And we don't say that somebody loves somebody more, but it's the intensity of feeling. I guess there's a difference between level and intensity, and I'm not sure I'm being clear about that, but that's how I would put it. So I want to talk about physical disabilities, but I'm going to kind of zoom through this because we all know what I'm talking about by physical disability. And the caretaking responsibilities for people with physical disabilities vary greatly. Again, it's a continuum. You have a child born without arms or legs, they're going to need a lot more caretaking than someone even with cerebral palsy that can walk. And there's a spectrum of that too. There are people with CP who need an electric wheelchair and you can't understand anything they say. And there are people who you might not know have CP. They walk with a limp, or maybe they have a speech difficulty. But I chose CP because it's the easiest to talk about a spectrum, from needing very little care and accessibility to needing a lot of care and accessibility. There are access issues, ramps, personal care. When we talk about caretaking responsibilities, movement. I have a friend who has CP and he's in an electric wheelchair, but he learned how to get himself into a prone stander so he can get into the bathroom by himself, so that he didn't need someone in his house 24/7. I have another friend who's in a wheelchair, is constantly, and rightfully so, complaining about the access to parking the van, to getting up on curbs. Very often people will have ramps up to their building or homes, but the ramp only goes up to the top, and then there's a lip or a step to get into the building from the ramp. The ramp doesn't go even with the step. That happens a lot. I've seen it everywhere. And if somebody needs a ramp to wheel up in their wheelchair, they can't then get in your house if you have a step to get in. Sorry, obviously I have a pet peeve about that. Obviously, the severity of this disability, which I think I already talked about. Their role in the family. So if you have a disabled parent, it's very different from having a disabled child. I have a friend named Pam. She was in a car accident. She is paralyzed from the third rib down. And she did what everybody told her she would never do. She had a child. She got pregnant and had a baby, who is now an adult, by the way. And it was difficult. It was okay while her daughter was a baby, but once she started running around and chasing things and it was a little harder to keep up with. Thankfully, she had another person around, but having a child who is healthy and active when the parent has a disability is very different from the parent being able-bodied and the child having a disability. And the effect on the system of each of those scenarios is very different as well. If you get a chance to see a program called Speechless. They address the issue of, sort of the attention of the physically disabled person, the attention given to the disabled person is different from the attention given to the other family members, sometimes causing the system to be dysfunctional in a basic way. Okay, everybody, this is take 5 on my cognitive disability slide. I'm getting tongue-tied, so I'm going to zoom through it, and if I stutter, stammer, whatever, you'll have to forgive me because I'm not recording it again. So cognitive disabilities include autism, Down syndrome, traumatic brain injury, or TBI, ADD, which is attention deficit disorder, ADHD, which is attention deficit hyperactivity disorder, dyslexia, dyscalculia, which I can never pronounce, and other kinds of learning disabilities, anything from the mildest learning disability to the most difficult. The difference between cognitive disabilities and intellectual disabilities are intellectual disabilities fall under the umbrella of cognitive disabilities, but they're specific to having a marginal or low IQ. That means 70 or lower. So the first thing is diagnosing. Diagnosis of cognitive disabilities is easier if there's a physical marker. With Down syndrome and children with fetal alcohol syndrome, which I didn't mention yet, there is a physicality to identifying them. So you can actually look at even a baby born with fetal alcohol syndrome and say, there's something going on there. Now with autism, you may know early if the child, for instance, has a severe speech expression of speech, verbal expression problem, or it may be later if the child is a different place on the spectrum, like more towards the Asperger's syndrome spectrum, where they're talking and they're interacting. They may not like to be touched. They may not be very huggable, and it's not until you're taking them out in public a lot and they're either having a meltdown or behaving strangely that you realize there's an issue. So a child with Down syndrome might be diagnosed in the first year, and a child with the Asperger's type on the autism spectrum may not be diagnosed till they start school. All of the cognitive disabilities tend to have behavioral issues that go with them, and that's because they're cognitive disabilities, and the kids are trying to sort of, a system tries to stabilize itself. Well, we all try to adjust or adapt to the situations that we encounter, and children with cognitive disabilities are trying to adapt through their behavior. So often that can be problematic. Often it is not problematic. Often, a lot of Down syndrome kids like to hug people, even strangers. And you won't believe this happened, but it happened before my eyes. A school principal once suspended 3 Down syndrome children for hugging in the hallway. Obviously, that principal needed a little more education and possibly a little more compassion. So resources are needed and oftentimes hard to find. We tend to think these days that, oh, well, there's all these services. But if you ever go to a school board meeting while they're working on the budget, the first things they try to cut are special needs programming. They have to, by law, by federal law, provide services to special needs services to children with disabilities. But the resources don't have to be, there's there's no law that they have to be good or the people doing them have to be good. So it's sort of like government buildings that they take the lowest bid. You know, you're not sure what they're going to have for special needs resources. I actually knew a special ed director who used to just say to parents in IEP meetings, and IEP is an individual education plan. He'd say to them in IEP meetings, they'd say, well, we want a functional behavioral analysis. And he'd say, oh, you don't want that, which is totally illegal. You totally can't say that. Okay, I'm chasing a squirrel, sorry. So the level of the child's disability determines the services needed, the time that caretakers need to spend. My friend Tony had a child with a physical disability, a mild cognitive disability, she had learning disabilities, but she was in an electric wheelchair, and Tony had to go to school when she was in kindergarten every day and take her out for recess because the teachers refused to do it because it was too much work. The school resources and special placements, and the adjustment of the family system expectations. If you find out your child has a learning disability and you want them to be Albert Einstein, you're going to have to change your timeline for that. Or you're going to have to lower your expectations just a little. And I hate saying lower because you just have to adjust them. Maybe they're high expectations, but in another area. Maybe you could have high expectations for socialization or you create expectations that are specific to that child, and the entire system has to sort of adjust to that. The thing I didn't address here is parents with cognitive disabilities. Sometimes that's an issue and sometimes it isn't. I would say it's more of an issue if the parent has an intellectual disability, because you can't teach someone more than you know. But that's what resources are for. So I'm not saying, oh, people with Down syndrome shouldn't have children, although Down syndrome is genetic. But I'm going all over the place, sorry. What I'm saying is that's when you use specific resources, is when one of the parents has a cognitive disability. Families where one or more member experiences a mental illness or severe emotional challenges face specific obstacles. I'm going to use examples. One is a 16-year-old boy who was just diagnosed with schizophrenia, and one is a 20-year-old young woman who has just been diagnosed with borderline personality disorder. And I want to use examples so that I can talk about what happens and the different stages and issues that go along with mental illness in the family. So the first thing is what I call diagnosis shock, which is it's a shock to the system and the individuals in the system, especially the individual who's been diagnosed with mental illness. So the 16-year-old boy who's just been diagnosed with schizophrenia, he's been acting strangely. You can look up the diagnostic criteria for schizophrenia, but he's hallucinating, he's hearing things, he's not able to function or focus at school. He has hurt himself once or twice because a voice told him to do it. And he's sitting in a psychiatrist's office with his mother, and he's told that he has been diagnosed with schizophrenia. And it probably wouldn't be in a doctor's office now that I'm thinking about it. It'd probably be in the hospital, because typically at the onset of schizophrenia, there's a psychotic break that requires an intervention. As far as the 20-year-old woman, she would probably be told, because she's 20, by a psychiatrist that she has, or a psychologist, that she has borderline personality disorder, which is a personality disorder, which means there's no actual medication, or they can take mood stabilizers, but there are interventions, but really no significant, like there's no cure. It's not time limited. It's not, a lot of it is behavioral, and it's difficult when people are diagnosed with a personality disorder because they're very persistent. Anyway, both people would have a diagnostic shock, because it's hard to hear. It means that the trajectory of your life has changed significantly, or that there are many more obstacles to achieving the goals you used to have. Diagnosis is sometimes age dependent. There are things you cannot diagnose a child with. So you may be a 20-year-old with borderline personality disorder, but if you were 7, you would have reactive attachment disorder, because you can't diagnose someone who's 7 years old with borderline personality disorder. There is a huge controversy right now about diagnosing schizophrenia young, because a lot of mental illness looks really different depending on what age you are. Most schizophrenia happens, or the psychotic break, we used to say happens between 18 and 22, but now it seems to be between 14 and 24. So I don't know what happened, but maybe we're just identifying it more correctly. So after someone finds out they have a mental illness, there's a period of grief. It may be grief for their future. It may just be sort of way to handle it's really difficult. And I've seen people go through it. I've worked in the field for over 30 years. So I've seen the different ways that people handle the grief around learning that they have a major mental illness. Sometimes they do that with acting out. Sometimes they just kind of disappear for a while. They're not who they were a few minutes ago. But of course, the system grieves as well. One of the problems that comes up with dysfunctional families is that it's really easy to look at the person with a mental illness and say, that's the problem. And you'll remember what we call that in family systems. We call that, or at least on the Beaver scale, we call that the symptom bearer. And so this person actually has mental health symptoms and is made into the scapegoat for the family issues. There are a lot of challenges of treatment. They include trying different medications and identifying whether behavioral issues or personality issues are part of the illness, or they're contributing factors, or that's just the way the person is, or the way they're choosing to be. Like I used to say, you can be a schizophrenic without being a jerk. Like, that's what I'm talking about. I know quite a few, I have known in my life quite a few schizophrenics who were not jerks, who were very kind people who were suffering terribly. So with a mental illness, with a mental health diagnosis, a lot, especially these two diagnoses, the schizophrenia and the borderline personality disorder, there's a huge stigma attached. You don't want the world to see you as your illness. You want to be a person with a mental illness, not a mentally ill person. You can hear the difference. It's person-centered speak. So there's a stigma for that person, which creates, at least at first, a significant emotional isolation. But there's also a system-wide, the whole family system falls into this space where they're like, they may not, other members of the system may not tell people that they have a family member with a mental illness, which creates more of a stigma around that person. But oftentimes when this occurs, the rest of the system doesn't know how to react. And we know that it changes the whole family system, because if one part of the system changes, what happens, everybody? The rest of the system has to make some adjustment to it. It's interesting when I say addiction, what's the first thing that comes to your mind? Drugs, alcohol. Some people are addicted to gambling. Some people are addicted to shopping or spending money. There are all kinds of addiction. I'm going to be specific to drugs and alcohol because it's easier for everybody to focus on that specifically. So when a parent or child has an alcohol or drug addiction, it creates an isolation of the family system. The system closes to outsiders. If you have a parent who is an alcoholic, you don't want your friends to know that. You don't want anybody to come over. I have a friend who is in recovery herself, and we were on the beach one time, and she said, don't you wish sometimes like you could just have 6 or 7 beers with dinner like a normal person? And I said to her, you do know that normal people don't have 6 or 7 beers with supper, right? But she grew up in a family where her father brought a 6-pack to the dinner table. So that was her experience. And because her family was so isolated from the rest of the community because of the alcoholism, because of trying to hide it, she had no idea that that was not a normal behavior. Again, we can make the person with an alcohol problem or an addiction problem the symptom bearer. We can say this is the issue. When sometimes, especially if it's a child, it is the system issues that have caused the change from the primary issue being the family to the primary issue for that person being the addiction. So children living in homes where addiction is central often have issues as adults with moderating emotions and behaviors, by the way, and are often socially awkward. So if you live in a closed system, you don't know how necessarily to function appropriately in the real world. I mean, you may adjust and adapt to that as you go older, but when you're younger and you're first sort of on your own, it's really hard to learn how to moderate and adapt to sort of, and I hate the word normal, but you know what I mean by normal, sort of normal being the median, you know, the average. So, yeah. I'm going to go through this quickly because we already have spent a good amount of time on domestic violence. So if you have questions or you're thinking about something I didn't include, refer to your notes from the domestic violence unit. Domestic violence creates instability in the system, and that's obvious from what we've talked about already. And instability in the system creates a problem with what? Right, security and safety. So individuals can't achieve a sense of safety or security while there's violence in the home. Unpredictable behaviors create fear and anxiety in children and adults in the system. And a system that's full of fear and anxiety is not safe, and sometimes is not doesn't provide for the physiological needs as well. It's a closed family system, like a system with addiction. Children living in an environment where intimate personal violence, child abuse, sexual abuse, verbal, emotional abuse, or fearful environments, like a war zone, for instance, may experience cycle reoccurrence, meaning maybe somebody is violent in their own relationship, or they experience violence again. Not of their own accord. Predators tend to drift towards people who have been victimized already. Low self-esteem, addiction problems, and relationship issues, either being clingy or having commitment issues. We are running out of time, so I'm going to talk quickly about other stressors and other issues. I'd rather say issues than stressors. Infidelity is an issue, and it's one of those silent issues where the system may or may not know that it's happening, but it still has an impact on it. Behavioral issues, if you have children that are acting out, if you have parents who are having midlife crises and acting out that way. Communication difficulties. We know how important effective communication is, and we all communicate in all kinds of ways, but effective communication is really important. Violent sibling rivalries, which I could spend a week on, but are often, again, sort of swept under the rug, and maybe they're not noticed for a long period of time because the parents are in denial. Displacement issues, for instance, the one that always pops to mind is if you were an only child for 10 years and then your parents had another child, you might feel like you were displaced or replaced, and as a result feel abandoned. This happens with two parents for very different reasons, which I won't do that right now. The things that aren't on here are religious differences. I knew someone who was Jewish who married someone who was very Catholic, and it was not an issue until they started having children, and both sets of grandparents wanted to influence what religion the children were raised in. And cultural differences and subcultural differences also are impactful. I have a brother-in-law who is English, Irish, and Scotch, and my family is basically mostly Italian, and we are Italian in the way we behave as well. When he first met my sister after about a year, he said to me, "Do you guys have parties for everything?" I'm like, "Yeah, pretty much. We have parties for everything." So a couple of months ago, he took one of those Facebook quizzes that said, we can guess your nationality. This is 34 years later. And his nationality came out as, I can't remember, 92% Italian. And so I said to him, resistance is futile. You will be assimilated. It's so funny. He spent so much time immersed in our culture that without looking at him, he would appear to be Italian. Yay for us. Oh, and if you don't know that pop culture reference, resistance is futile, you will be assimilated, look it up. It's interesting. Interventions, all of which we have spoken about, except I think the first one, which are family meetings to address emerging issues as they arise. If you have effective communication in your family, you may not need the other interventions. So we have family therapy, systems, structural, etc., all the ones we've spoken of so far. Individual therapy for identified patient or symptom bearer, as well as couples therapy for the parents of the symptom bearer, and crisis intervention, which we'll talk about more when I see you on Wednesday. Here are my questions for you. What do you think are the most difficult challenges facing families today? How do each of these challenges affect specific levels in the hierarchy of needs? And what things can be done to address or circumvent these issues from destabilizing the system? Answer one of these questions and email it to me, and I will see you all on Wednesday morning, bright and early at 8 o'clock.